We have an update this morning on a story affecting many breast cancer survivors in this country. Government regulators have now decided to abandon a plan that threatened to eliminate an option for patients who want to have breast reconstruction surgery. Our consumer investigative correspondent, that's Anna Werner. She's been tracking this issue for months now and joins us with the latest. Anna, good. Welcome back. Always good to have you here.
Good morning, Gayle. We've been telling you all year about the government's plan to change the way a certain type of breast reconstruction surgery would be categorized, a change that potentially would have meant that only the wealthiest patients could afford it. It's called deep flap reconstruction. Now, instead of implants, surgeons use a woman's own tissues to reconstruct a breast, a more complicated but more natural option. We met a number of breast cancer survivors like Kate Getz, who told us they were struggling to find a surgeon who would perform the surgery under the new billing rules. She wanted to use her story to bring change.
I felt like the only way we were going to get insurance companies to change and to roll back what they were doing was they needed to hear us. I think they need to see us, and I think they need to hear us.
Getz did get her surgery only because a Texas surgeon, Dr. Elizabeth Potter, took her much lower insurance payment, despite the fact it didn't totally reimburse her. Now, after our reports and receiving feedback from women and surgeons at a hearing in June, the Centers for Medicare and Medicaid Services now says it will keep the codes that allowed surgeons to be paid more money for this operation. It's a huge win for doctors who say that this should help preserve options for women, that if the government hadn't reversed essentially the way they code this procedure, they were going to eliminate these codes, and the surgeons were like, we're going to go out, we won't be able to offer this anymore.
Wow.
Yeah.
This is, the advocates and women and surgeons are over the moon today because they're saying that this really makes a big difference.
Yeah, a huge win certainly for the women and the surgeons, but it's kind of sad that it all boils down to the money. Just a simple changing of the code now makes it,
The money and the coverage, which is bring a lot of important attention to this.
Yeah, well, it's great to see this happen.
Yes.
All right, Anna.
Thank you, Anna.
Thank you so much.